Hello students, welcome to this session, chapter number 14, ventilator associated pneumonia. So it is pneumonia that occurs in 42 to 72 hours after endotracheal intubation or mechanical ventilation. It is characterized by presence of new or progressive infiltrate, sign of systemic infection, that is fever, increased total leukocyte count, worsening oxygen percentage of saturation, and changes in sputum character. In that culture is positive and the microorganisms isolated are commonly Pneumococcus, Acinetobacter, Pseudomonas, H. influenzae, MRSA, that is methicillin resistant Staphylococcus aureus, E. coli and Klebsiella. So here you can see this ventilator given to the patient. So in microbiology, if it is early onset, in 4 days the bacteria are Pneumococcus, H. influenza, MSSA and Moraxella. MSSA is methicillin sensitive Staphylococcus aureus. And if late onset, that is more than 5 days duration for the ventilator, then it is Pseudomonas aeruginosa, Acinetobacter baumannii, E. coli, Klebsiella, Serratia and MRSA. The source may be endogenous or exogenous through air, water, equipments or nebulization medicines. The pathogenesis is entry through the aspiration of oral gastric secretions or direct extension of infection or inhalation of aerosols, or it may be hematogenous. The risk factors are divide associated. So it is duration. If more duration, more risk for the ventilator associated pneumonia. Then re-intubation is one factor, nasogastric tube or humidifier used. Then change of ventilator circuit, aspiration of gastric fluids or aerosols, the inhalation, intracuff pressure if it is less than 20 cm of H2O, irrational use of antibiotics, or maybe patient is having stress ulcer, antagonist, antacids, sedation or tracheostomy. So these are the risk factors associated with the device. Then patient associated factors, the age more than 60 years and males are predominant. Then duration of the hospital, more the duration, more the pneumonia can happen. Then illness, like patient is having COPD, chronic obstructive pulmonary disease or ARDS. Then supine position, coma, poor nutrition, immobilization, decreased immunity, burn, sinusitis. So these are all patient related factors. Then healthcare related factors, in that improper aseptic precautions while handling the endotracheal tube or ventilator and contaminated environment. So diagnosis can be mechanical ventilator should be more than 2 days. Then symptoms, anyone like fever, hypothermia, leukocytosis or leukopenia, and culture is positive from the respiratory secretions. So these are the diagnostic criteria for ventilator associated pneumonia in hospital acquired infection. Then prevention should be, hand hygiene should be done, elevation of head 30 to 45 degree to prevent aspiration. Then oral care with chlorhexidine, that is 2% solution should be used. Peptic ulcer prophylaxis can be by sucralfate only. Then deep vein thrombosis prophylaxis should be done, and daily assessment for the removal of the ventilator or endotracheal tube should be done. These are my references from which we can study. I hope this session you will find useful. Thank you.